Measuring and improving hospital quality of care, particularly outcomes of care, is an important focus for clinicians and, of course, policymakers. The Centers for Medicare and Medicaid Services began publicly reporting hospital 30-day all-cause risk-standardized mortality rates for patients with acute MI and heart failure in June 2007 and also for pneumonia in 2008. CMS has expanded public reporting to include hospital 30-day all-cause risk-standardized readmission rates for patients hospitalized with these three conditions. Mortality and readmission measures have been proposed for use in federal programs to modify hospital payments based on performance, but there has been concern that hospital mortality rates and readmission rates might have an inverse relationship. For example, hospitals with lower mortality rates are more likely to have higher readmission rates because interventions that decrease mortality might also increase readmission rates by resulting in a higher risk group being discharged from the hospital. Now in JAMA, researchers clarify this complex problem. They report on a study of Medicare patients discharged with MI, heart failure, or pneumonia, and quantified the correlation between hospital mortality rates and readmission rates and determined the proportion of hospitals with better and worse performance on both measures. The outcomes of this report are complex, but let me summarize it for you. The short version is that risk-standardized mortality rates and readmission rates were not associated for patients admitted with an acute MI or pneumonia and were only weakly associated within a certain range for patients with heart failure. From a policy perspective, the independence of these measures is important. A strong inverse relationship might have implied that institutions would need to choose which measure to address, but that was not the case. The findings indicate that many institutions do well on mortality and readmission rates, and that performance on one does not dictate performance on the other. I'm Peter Block, and this is a CardioSource Heart Minute.